Jeff Fleming doesn't remember a time he didn't have psoriasis. A recent medical study shows a new era of dramatic symptom improvements may be in store. And that's encouraging news for the more than 500,000 Canadians with this chronic inflammatory skin disease, which can have a big impact on quality of life.
Living with psoriasis since an early age of about 2, at first you don't really notice the disease as much as you notice other people's reactions, and you develop a tough outer shell. Flare-ups with psoriasis sort of made me withdrawn, and you sort of hold back in life. The winters are bad, so the cold is very harsh on your immune system. Your body's trying to fight back.
Cold weather is just one of the triggers of psoriasis. Others can include emotional stress, smoking, alcohol intake, and certain medications. Dr. Richard Langley, professor of medicine and director of dermatology research at Dalhousie University, says recent developments in psoriasis treatment can offer significant relief from the condition.
I have patients that I see on a daily basis that have a negative impact due to psoriasis, be it because they can't work if it involves their hands, if they can't walk on their feet. In general, you can expect at about 12 to 16 weeks that the patient should have achieved adequate response. And if they haven't at that point, it's time we have to reconsider. The main way patients can improve their condition is they can look at some of the more effective therapies that are out there. It may be, for example, moving towards some of the more effective agents such as biologic therapies, which have been recently introduced in Canada and can provide clearance to significant numbers of patients.
Of all the various treatments that I've been on since I've had this disease, and there are numerous ones, tar baths, ointments, gels, creams, UVA and UVB light treatments, nothing seems to work in the long term. When I began taking Remicade within about 6 weeks, I noticed a tremendous improvement, almost about a 99% clearance of the disease. The intervals are great. The disease has slowed right down. It's almost like you've evolved, become a new person.
I think some patients have actually dropped out of the system. They've become discouraged, and certain studies in Canada and the National Psoriasis Foundation have shown that patients are frustrated. They believe that the treatments are ineffective, and they're unaware that there have been significant advances in some cases. Well, the goal of therapy is to make our patients happy. And patients are happy when their psoriasis is improved, their arthritis is controlled, and ultimately their quality of life is improved. If you can go from 40% to 70% clearance, you're going to have more patients that are happy.
And that's very welcome news this winter for those living with psoriasis. Martin Vanderwood reporting.